Antimicrobial resistance becomes a major public health and human security threat globally.
We convene multi-sectoral One Health partners. That convening results in producing One Health report since 2017.
The Thailand One Health dashboard on antimicrobial resistance is a platform that compiles multi-sectoral data on antimicrobial consumption, antimicrobial resistance, and on knowledge and awareness on antibiotic use and AMR.
It serves as a guide for national monitoring of such antimicrobial resistance indicators. The antimicrobial resistance can also guide antibiotic prescription at the hospital level as well.
At present, antimicrobial resistance becomes a major public health and human security threat globally. Thailand has acknowledged the problems and implemented the National Strategic Plan on Antimicrobial Resistance since 2017. Intersectoral mechanisms in human, animal, and environmental health in both public and private sectors have been established to collectively tackle antimicrobial resistance based on the One Health concept. We realize that evidence is important to support implementation, particularly at the political level. Therefore, in our country, the Health Policy and Systems Research on Antimicrobial Resistance Network has been established with the collaboration from several public and private institutes, including universities, to tackle the problems. Last year, the network established the Thailand One Health dashboard on antimicrobial resistance. These data are essential in monitoring trends of antimicrobial resistance in Thailand. It also enables the responsible agencies to monitor targeted information and related vital factors for policy decisions following the National Strategic Plan. As the chair of the National Committee on Antimicrobial Resistance, I am honored to say that Thailand One Health dashboard on antimicrobial resistance is considered Asia's first database to present comprehensive and integrated information of antimicrobial consumption and resistance in humans and animals. Currently, the database has received much attention from many countries. It is an outstanding success that Thailand is very proud to present.
In 2016, WHO adopted World Health Assembly resolution on AMR that triggered the process in Thailand to drive AMR policy. We convened multi-sectoral One Health partners, transdisciplinary, public, private, government agencies. That convening resulted in producing One Health report since 2017. We have produced annual report in 17, 18, 19, and 20, and more to come on an annual basis. This report consists of key elements for policy. First, AMR in human and animal, both prevalence and profile, including food chain. Second, consumption of antimicrobial in animal and human sector. Third, public knowledge and awareness on AMR, for which we work closely with National Statistics Office, and we are able to produce this public awareness on a biannual basis. Not only generate evidence, we also inform policy through the meeting of the National Steering Committee chaired by Prime Minister. At each meeting of the National Steering Committee, we inform policy, and all these multi-sectoral, multi-stakeholder members in the National Steering Committee are aware of the progress and lack of progress, so that they implement the strategic plan accordingly. A few work in progress, which is we will introduce AMR in environmental sector. We work closely with Department of Pollution Control, and the One Health report will be more comprehensive. This One Health report and subsequently the dashboard was recognized by international partners as one of the key contributions to drive national AMR as well as a role model for other countries in the region. We found that AMR was guided by all this evidence on monitoring progress, achievement and challenges in the implementation. At the same time, we also published quite a good number of papers on AMR from Thailand. Of this achievement, we still find more improvement to go, both in terms of generate more accurate evidence as well as inform policy.
One of the goals of the National Strategic Plan on Antimicrobial Resistance is to reduce antimicrobial consumption in humans and animals, aiming at 20% reduction in humans and 30% reduction in animals by the year 2021. This policy is a system response to the national concerns on antimicrobial resistance related issues. Antimicrobial consumption has been identified as an essential indicator for continuous policy monitoring. We started the project by establishing the method of data collection and analysis of antimicrobial consumption using 3-year data of 2014 to 2016 as the baseline. After several years of antimicrobial consumption report and the longitudinal data was available, the dashboard of antimicrobial consumption is then developed for several purposes, including tracking of the changes of antimicrobial consumption, as well as serving as the annual public report of the National Strategic Plan. The process is inclusive of all sectors under One Health concept. The success of the project is integrated contributions from both public and private sectors, including Thai FDA, Department of Livestock Development, Department of Fisheries, scholars from many universities, International Health Policy Program, as well as several professional associations, private companies, and many others. It is considered a showcase of Thailand's commitment to resolving antimicrobial resistance alongside the international community. The achievement of the national policy requires continuous assessment of antimicrobial consumption in both human and animals. This data will not only serve as the policy empirical indicator, but also support policy decisions on all aspects related to antimicrobial resistance.
Thailand One Health dashboard on the antimicrobial resistance consists of data from human and livestock sector. One of the most important data is antimicrobial consumption in food-producing animals. It helps monitoring the country's situation on antimicrobial resistance. Data on the dashboard demonstrate that the total amount of the antimicrobial consumption for food-producing animals decreased by 49% over the 3 years period, from 2017 to 2019. The data can be used to determine the antimicrobial consumption level in medicated feed to the feed mills to minimize the irritation use of antibiotics. Besides, it contributes to raising awareness and promotion good practice regarding the use of antimicrobial in animals. For policymakers, health professionals, and livestock farmers, the data are utilized by the related government agency and the private sector in monitoring the appropriate use of antimicrobial, tracking the internal and national trend for further reduction of antimicrobial consumption in livestock.
The data on antimicrobial resistance in humans in Thailand has been collected and developed since the year 2000. The nationwide data is collected by the National Antimicrobial Resistance Surveillance Thailand by the Department of Medical Science. Furthermore, antimicrobial resistant data in patients with hospital-associated infection is contributed as pilot data in the year 2018 by the effort of Bamrad Naradun Infectious Disease Institute and many hospitals. This data presented comprehensively posts the success of monitoring and evaluating the situation of antimicrobial resistance in humans. The data on Thailand One Health dashboard on antimicrobial resistance demonstrates the trends and the current situation on antimicrobial resistance in Thailand. It serves as a guide for national monitoring of such antimicrobial resistance indicators. The antimicrobial resistance can also guide antibiotic prescription at the hospital level as well. It also allows policymakers to be able to generate information to support action to combat antimicrobial resistance, in particular antibiotic resistance at national, regional, and global levels.
The Thailand One Health Dashboard on Antimicrobial Resistance, or AMR, is a platform that compiles multi-sectoral data on antimicrobial consumption, antimicrobial resistance, and on knowledge and awareness on antibiotic use and AMR. It is such a unique multi-sectoral AMR platform, developed in a multi-sectoral way, as it was created through the shared efforts of the research team, the collaborative institutions across relevant sectors, and with contributions from various partners, including the Food and Agriculture Organization of the United Nations, or FAO, for food-producing animals. The compiled information on this shared AMR platform can shed light on the current AMR situation and trends. This will raise crucial AMR awareness and engagement among animal health professions. It will also positively influence and provide guidance towards better practices and more responsible use of antimicrobials by farmers.
Antimicrobial resistance is a significant global issue. The improper use of antimicrobial is a major cause of such resistance. Antimicrobial resistance not only harms humans, but the animals and the environment also bear great adverse effects. For example, the failure of antimicrobial use in the treatment of infectious diseases in both humans and animals, the increasing cost of hospitalization, and the spreading of antimicrobial resistance in food chains. Although dashboard does not include the empirical data for antimicrobial resistance in the environment, the data collection has been developed to assess the situation of future database establishments. Thus, it is essential to advance the data collection and establish for public knowledge and cover data under the One Health approach. The database can be utilized effectively monitoring the trend of antimicrobial resistance in the environment, as well as providing the data to assess the link of antimicrobial resistance in humans and animals.
We help organizations in Thailand design and develop data pipeline and data dashboard. We are really glad to be a part of revisioning Thailand One Health report into a powerful, interactive, data-driven dashboard for the first time. This Thai AMR Watch website provides beautiful and innovative solutions to analyze and compare the historical data and also future data for years to come. Moreover, it is an open data dashboard which is open for everyone interested in these topics. This project is indeed a big step towards data-driven policy development, which play a major role in every field right now. It is such a pleasure to work with IHPP team, and congratulations for your hard work.
Let me thank everyone for their efforts to contribute towards the success of this dashboard. The dashboard would not have been possible without the support from our Thai and international partners, notably WHO, Food and Agriculture Organization of the United Nations, and USAID, Regional Development Mission for Asia.